Hey there, it's Tom Corson-Knowles, the Authentic Health Coach. I'm here today with Dr. Candace Corson, and we're answering your questions from the Facebook fan page about good health and nutrition. Right now the question is, what can I do for asthma? I've got asthma, and I want to help with nutrition. What's the best way to prevent it, to treat the symptoms of it, to help get rid of it as well? So we're here with Dr. Candace Corson to answer the question for you.
If a person has a diagnosis of asthma, he or she really needs a good doctor that they can communicate with, and they need to work closely with their medical doctor because asthma is potentially a very serious and can be fatal. And really, we were taught in medical school a long time ago that no one should ever die of asthma because it has a strong reversible component. And in fact, I've watched many people over the years completely reverse their asthma and actually be in a normal state of health and feeling wonderful, not requiring any medication and not being sick. However, a person who has ongoing asthma cannot just go off their medications. That would be a really bad idea. In fact, anyone who's actually having symptoms of asthma at a given moment needs excellent medical supervision. Asthma, like most diseases, tends to get worse as the afternoon and evening comes on. So if a person is getting sick in the morning and getting worse, they're going to get much sicker in the afternoon and the evening and through the night, so sick that they can literally die. So I don't want to scare people, but just say that's one of the things that all doctors know that I would like patients to know. If you're getting sick in the middle of the day or in the morning and you're getting worse with your asthma, you're coughing more, you're having any trouble breathing at all, you want to be seen that day. You want to call that medical office immediately and let them know you're actually getting worse. And I will say there's a very simple, inexpensive tool that every asthmatic patient should have at their home, and I really mean every single one. It makes me really sad and upset to see sometimes if a person does not have this. It's called a peak flow meter. Peak is spelled P like Paul, E-A-K. Peak flow meter. It's available from pharmacies. I believe that it's good for people to ask for a prescription from their doctor. They only need to have one peak flow meter per person. And this is something that they can blow into as hard as they can blow, and it will measure how good their output is. In other words, how well can they push air out from their lung. Because even though it feels sometimes in asthma that we can't get a good breath in, the basic problem is that we're not able to move air out properly. It's called air trapping. We should be able to blow the air out of our lungs very, very fast. And that gets obstructed with asthma because asthma is made up of not only constriction of the airways, but inflammation of the lining of the inside of the airways. That's the basic problem. It's an inflammatory condition, and that is due to immune upregulation or irritation of the immune system. And of course, infection takes advantage of that. Many times people may have this triggered by, or it may be triggered by allergies, and then they get infection, or they may have an infection, usually viral, that triggers inflammation in the airways because of an upregulated, hyper-irritable immune system, and this can snowball or spiral out of control very rapidly. So having a peak flow meter is extremely easy and important, and it's easy for a parent to teach their child how to do this and know what the meaning of the reading is, or it's easy for a grown-up to learn how to do that. And then when they call the doctor's office and they tell them what their peak flow is and then it's going down, that will get them into the doctor's office very fast, or sometimes the emergency room may be necessary. It's way better to be treated early in an asthma attack than wait too long. And in fact, if people are sick for 2 or 3 days, it may take at least 2 or 3 days, if not longer, to even get them out of crisis once in the hospital. So the longer a delay is, the longer the hospitalization and the road back to health will be. I really say asthma is something you don't mess around with. Now, that being said, we need to use those medications along with our doctor and stick to that protocol. But here's the big but. It will not make you resiliently well. You have to do it because it's saving your life at the moment. That's very, very important. But if you want to get well, you're going to have to do some things that go outside of the level of training of most doctors. That's not to talk down about them, but I had the same training, really excellent training as so many doctors today. Nutrition was not part of it, and even today the vast majority of our medical schools in our country do not teach the nutritional science that is actually very well established in the field of basic sciences, the PhD realm of knowledge. So until we have that change in our medical schools, it's going to be up to the doctors that want to go after that in depth after their training is finished, the way I did, and it was specifically to help patients with asthma, and then that extended to other inflammatory conditions and all kinds of immune challenges, including autoimmune disease, which is one of my major interests. And then, of course, heart disease, any kind of chronic illness can be made better with excellence of nutrition and micronutrition from whole plants. We've talked about that before, and we can talk about that some again. But I like to give people places that they can go and read and learn on their own that are reliable. So I can mention some of those, and we'll do that in just a moment here. But I just want to finish that thought that 1, the peak flow meter is very important to have. 2, patient education is crucial. I truly believe that no one should ever, ever, ever die of asthma. We want to see that stop, and yet we're seeing a rise in asthma throughout our country, really rapid rise, and around the world. And a lot of this is due to industrial environmental air pollution. There's no question about that. That just should not even have to be a discussion. And that leads to one of the major things that people can do to decrease the severity of their asthma, and that is purchase and use a good quality room air filter. It's not very expensive. You want to use it 24 hours a day in the bedroom with the door closed, 24 hours a day. Now, if people find that they don't like to hear the noise of it, they can at least use it all day long with their room closed. This is creating a clean air environment, and then turn it off at night if the sound bothers them. But ideal would be 24 hours a day. So I will just give a list of the very powerful things. If people do all of these things, I have never seen a person not have dramatic improvement. 1, purchase a good quality room air filter, such as a HEPA filter. There are a lot of good places to purchase those, and it doesn't have to be expensive. And if they could do a whole house filter, that would be great. That's much more expensive. But in the short run, just get a bedroom filter for that child or that adult. It's very important. It's been shown to decrease the amount of medication needed. Just that simple intervention. 2, no cigarette exposure of any kind at any time, not even for 1 minute. No passive cigarette smoke. That means if anyone in the household smokes, they deserve to know that by smoking outside only, and I mean outside, I don't mean in the attic, I don't mean in the garage, I don't mean in the basement, because all of that air just chemically balances all of those molecules that are harmful to human beings and harmful to the tissues and irritating to the lungs. They go throughout the space. It doesn't matter if you try to smoke in the basement or another room connected to the house. It has to be outdoors. So I know, in my experience, almost everyone that I got to counsel this way, because they were asking for this kind of help, they were delighted to know that if they smoked outside only, that their loved one, whether it's their child, their spouse, that person who had asthma would be better already from that one intervention. No passive smoking at all, period. And it's really interesting how many people are trying to get better from their asthma, and they don't realize that they may have one exposure at work in an area where people smoke. It may be 5 minutes a day, but that will keep them from getting well. In those people who are sensitive to cigarette smoke, they're so sensitive that it starts a whole inflammatory cascade. They cannot get well until they have 0 exposure every day ongoing. So that's an air filter and staying away from passive smoke. If they work in a smoking environment, they're not going to get well until they switch jobs. It's that important. They just deserve to know that, then they can decide what to do about that. The next thing is to make sure that they have enough sunlight exposure all summer without getting sunburned, that they can create a high enough level of vitamin D. That's D like David. It's really the sunshine hormone is what I call it. Sunshine hormone. It's a hormone. It's not a vitamin. It was named incorrectly. And it is the hormone that regulates our immune system, helps us fight infection, helps us be anti-inflammatory, helps us have a lower risk of cancer, a lower risk of autoimmune disease, a lower risk of asthma, a lower risk of pregnancy complications, and obviously stronger bones. So D, if people call it vitamin D, I like to call it hormone D, is very, very important. Since we do not get enough sun in today's world, most people do not get enough because they're working so hard indoors, even in a sunny climate. Then when they go outside, they put on sunscreen, which stops vitamin D production. It comes from the skin, which makes vitamin D for us, but only in the presence of adequate sunlight. So most Americans are vitamin D deficient, and supplementing that is safe and easy. And I recommend a liquid form, which would probably be the best. There are small capsules that people can get from just make sure it's a pure company with a good reputation. I recommend for adults a ballpark of 4,000 units daily, 4,000. A lot of people recommend more than that. And for children, I would use 2,000 units a day. If they feel squeamish about it, at least use 1,000 units a day for children. But there's already good research in Scandinavia showing that using 2,000 units every day in newborns, starting as soon as they're born, lowers their lifetime risk of autoimmune disease, specifically type 1 diabetes, which is autoimmune, by 80%. So it helps the immune system to do the things it needs to do. So D is very important. And if people aren't sure, if they want to be very cautious, they can get a vitamin D level done, which will show how low they really are. So it's really important to have enough D. And we used to wonder, why do children and adults get sicker with respiratory infections, including asthma, towards the end of winter, let's say February, March, is really the peak, and it's because that's the lowest and worst level of vitamin D. It's all used up from whatever they were able to get in the summertime through sunshine in their skin, and those low levels will not allow the body to fight infection properly. So those are two important things to cover in this section, which is an air filter in the room 24/7, the door shut, no passive cigarette smoke ever, and adequate, good levels of vitamin D in the bloodstream. It is safe to start supplementation and then get a vitamin D level. It's going to take weeks and weeks and weeks for that level to improve. So those are two things I'd like to say. And then finishing up, we can do another section about the intake of what we're eating. It makes a huge difference in asthma, really big, and that's usually not taught in medical school because that's nutritional medicine. Basically, we want to go as much plant-based, whole plant foods, more vegetables, more fruits, nuts, seeds, grains, any of those that people are not allergic to, and hugely removing the foreign to the human immune system protein, casein, C-A-S-E-I-N, which is from dairy, from cow's milk, cheese, milk products. That those combination of those things, I've not seen a person not have dramatic improvement in their health. All the time, they need to be working with their doctor, staying on the medications they need, but working on the underlying mechanism of their immune function because it is reversible.
Thanks so much for watching this video today about allergies asthma and how to improve it. And if you have any more questions for us, check out the fan page. You can ask us the questions there. We'll answer them as soon as possible. Remember to check out AuthenticHealthCoach.com to get Dr. Candace Corson's Top 5 Nutrition Tips Report totally free as our gift to you. Have a great day. Take care.